8:47 BBC Radio London. Jacqueline Shepherd here with you till 10 o'clock. Time to have a conversation with my next guest. Now, she is part of a community-driven organisation dedicated to addressing health inequalities affecting Black women and other marginalised communities. Phoenix Health Movement are working alongside Do It London, the capital's citywide HIV prevention programme, in a response to data which shows that Black Londoners remain disproportionately affected by the virus, with nearly 1,000 people newly diagnosed in 2024 and a significant proportion of them being Black women. Susan Cole is the Executive Director of Phoenix Health Movement, and I'm delighted to say that she joins me now. Welcome.
Hi, Jacqueline. Delighted to be here.
Yeah, lovely to have you here. And such important conversation. Let's start off with finding out a little bit more about Phoenix Health Movement.
Sure. So Phoenix Health Movement was set up by me and an HIV consultant from Barts, Dr. Vanessa Rapia, to help challenge the inequalities that are affecting Black women. We know that Black women are affected by health inequalities across so many different conditions, including maternal health, mental health, HIV, the list goes on. So we're focused on providing clear, accurate information to help people with the information that they need to advocate for themselves. And also we're campaigning to bring about change.
Yeah, okay. When I was introducing you there, I mentioned that the latest stats, which are actually from 2024 on HIV infections in the capital, show that Black Londoners and Black women in particular were disproportionately affected. And I'd love to get an idea on why we think this is, or why you know that is from the data, the research and everything that you have.
Absolutely. So yes, the data is quite stark about Black women being disproportionately affected by HIV in the capital. And in terms of the reasons, I think it's quite multifaceted. As I've said, Black women are affected by health inequalities across so many different areas, and HIV is just one of them. And it's nothing that Black women are doing wrong. It's more that the system is often letting us down. We're not given the correct information in terms of HIV testing. Often it's in places that we don't go. Many Black women have faced discrimination in healthcare settings, for instance, so maybe reluctant to go to clinics or to seek help. So that there's a number of different factors. And also in our Black communities, we're less likely to talk about sex, for instance. So there's a number of reasons that are causing it, but ultimately it's nothing that Black women are doing wrong. It's just a matter of needing the right information to be empowered to make the decisions to take better care of our health.
Yeah, and you've been working with the London HIV Prevention Programme and Do It London's Glam Squad events to try and ensure that you're reaching some of the women who may be impacted by some of the things that we're talking about. Can you tell us a little bit about that?
Absolutely, yes. I've been working with Do It London as part of the One Voice Network, which is a coalition of Black-led HIV charities, and we are running Skin Like Mine, an HIV campaign by and for Black Londoners in terms of tackling HIV inequalities and encouraging Black Londoners to test for HIV. This programme is being funded by Do It London, and we've been working with the Glam Squad at events, which has been so much fun. So we're actually taking information about HIV into the community, encouraging people to test in areas where they're comfortable and letting people know that HIV has changed. Lots of people think about the tombstones and iceberg campaigns.
Yeah, so that campaign from back in the 80s, and that's called the Tombstone campaign, and the fear that it put in so many people at that time, the fact that it's still talked about goes to show the impact that had and the ripple effect that still has. So it's about sort of taking away some of that stigma and reintroducing the conversation in a way that will not frighten people away from actually, finding out what they need to.
Absolutely. I mean, the reality is that HIV has changed.
Yeah.
People on effective treatment, it's impossible to pass the virus on to sexual partners. People with HIV can live as long as anyone else. Women with HIV can have children born free of HIV. People can do any job. But stigma continues to act as a barrier to people, particularly from Black communities, for testing, taking treatment, staying engaged in care. So we're really focused on getting those messages out and also letting people know about HIV testing.
Yeah.
It's really quick and easy. You get your results straight away. We're also talking about HIV PrEP, which is a pill that people can take to prevent HIV acquisition. And one of the really great things about the Glam Squad events was that we had people doing hair and makeup and fashion.
Because there was an event at the Peckham Palms.
Yes.
So tell us about that.
Yeah, so I was at the event at Peckham Palms and it was so much fun. I had my nails done by an absolutely amazing nail technician. And I was talking to her about the conversations that she was having as part of these initiatives. And she was saying, it was quite unique to be able to be doing someone's nails and then actually just chatting about HIV with them. And so people were also, they were getting their beauty done. They were also having wider health tests.
So the nail technician in that setting then will have been given some training or some information to be able to then pass on and have an informative discussion with her customer.
Absolutely, yes. She'd had some training. She was talking about HIV, and then she was passed on to members of the One Voice network who talked more about HIV. People were going then and having testing, as well as having things like cholesterol tests, high blood pressure tests. It just made it all so simple and easy in one place. And actually, I was chatting to someone there who said that she was just out shopping in Peckham, and then one of my colleagues, Hussaina, was actually walking around in the street and encouraged her to come along, and she got her nails and her makeup done, then went and had an HIV test, also found out that her cholesterol was a little bit high, but then she was signposted to see her GP. So it was a lot of fun.
I was going to ask you actually about that, about impact and some of the people that you've met along the way, particularly when you are discussing topics. You said that the topics, it's not just HIV, but that is a very important part of the conversation as well. But I wonder if you can relay the impact that some of these conversations have had on people. Maybe you've heard later down the line, I spoke to someone that day and this is what happened next for me. I wonder if you can give us some insight.
Absolutely. So at the Peckham Palms event, just when I was about to leave, there was an older gentleman who was sat outside actually with a bottle of rum. And I said, we're doing HIV tests. Why don't you come along and have a test? And he was like, I haven't done it in a really long time. I'm a little bit scared. And, I talked to him about, it was nothing to be afraid of.
Yeah.
He asked if he could bring his rum with him. And I said, yeah, it was fine. Just come on in. And he had an HIV test. It was negative. And I spoke to him afterwards and he said that he was so glad that he had done it. And I think very often, when it's welcoming and when it's by Black communities, for Black communities, it just makes it so much easier, especially when you think about our older generations who face so much racism in the healthcare system.
Yeah. Tell us about some of the other work that Phoenix Health Movement is doing, and one thing that you'd urge Black Londoners to do this year to advocate for themselves.
Absolutely. I think that knowledge is one of the most important things for Black Londoners to have. We know that we face health inequalities, but that shouldn't be a barrier to us getting the best possible care.
If someone doesn't know what you mean by health inequalities, what would you say?
So I would say that means essentially people from Black communities, for instance, are more likely to be diagnosed late with cancers, more likely when we go and speak about our pain and our symptoms to be dismissed, for instance. So I think it's really important that we advocate for ourselves, know our rights. If we're not happy with the care that we're getting, to change and to speak up for ourselves, because I think really knowledge is the most important thing for people.
Yeah, okay. And so I was going to say about the other work that you're doing. We've got about a minute. If there is somewhere that people can go to find out, if it's phoenixhealthmovement.com, and are there any events coming up?
Absolutely. Go to phoenixhealthmovement.com. Go on there. We've got a broadcast series called Rooted and Rising with Dr. Vanessa Rapia. The next episode is on Wednesday.
Where's that? What platform is that on?
That's going to be on our YouTube channel. We have Dr. Neka Nkwolo talking about HIV prevention. We also have a midwife. So there's lots going on talking about Black women and the health inequalities that we face and how we can advocate for our best possible health. And also people can go to the One Voice Network to get more information as well about Skin Like Mine.
Lovely stuff. Thank you so much. It's been really great to have you here to hear all about the work that you're doing. So if you missed it there, so for more information and more on the work from Phoenix Health Movement, go to phoenixhealthmovement.com. You can find out lots of information there. And you can also, I would imagine, find out about more of the Glam Squad events, which are coming up as well.
One Voice Network.
On the One Voice Network as well. So lots of things happening and lots of places to be able to find out. Thank you so much, Susan, for coming by this evening to talk to us about it.
Thank you so much.
Okay, coming up on the other side of the news, there's going to be lots more chat. I'll see you after 9.